Hi, today we're going to be talking about sexual disorders listed in the DSM. I would like to caution that, this material is, uh, some sensitive material. It is professional and therapeutic, and we will deal with it in a professional and therapeutic manner. And yet the content is for adults. So please, while you're watching this video, um, make sure there are no young children uh, in the vicinity. Um, okay, with that word of caution, uh, we'll begin our lecture. So, there are many, many types of sexual disorders. I divide them into two categories. One, the first category are sexual disorders caused by physical issues. And we should, of course, refer to a physician or specialist for those. They might also cause some emotional issues related to that because nobody likes having a physical problem. However, the other category would be sexual disorders that originate in our minds. There's a direct connection, of course, between physical and mental in this category, and often that line is blurred, but sometimes it helps. The first thing I would like to do is just reiterate that I think if you see any client long enough, this topic will come up. There are two topics that I think are part of every human life to some degree. The first one is grief and loss. Everybody experiences grief and loss if we are human. And we have a course on that. It's taught about every other year. I'm hoping to teach it either winter or summer, but it won't be both. So if you're interested in that topic, take it. The other subject that affects every human being in a different way is sexuality, human sexuality. And we thought this was also important enough. Dr. Gruber created a course on human sexuality, and we also teach that every other year, either in winter or summer. We usually don't teach human sexuality and counseling the same time we teach grief and loss. We usually alternate, but when I was a master's student, we had an entire course that was a required part of our counseling curriculum. And my professor only taught that course. She was retired. She was in her 80s. And she came back just to teach that course. And she was a pioneer in the area of human sexuality. She worked with Kinsey Institute. She worked for Masters and Johnson, and she did some pretty revolutionary studies. The other thing that amazes me is that even though this is such a part of human life and counseling, um, we're still in the infancy stage, the very beginning of understanding these issues and this aspect that is such a part of our lives. It was not that long ago that Kinsey did the very first research into human sexuality. He did a book on male sexuality, and then he did a report on male sexuality published in a book, and then a report on female sexuality published in a book. And then Masters and Johnson also began exploring this subject. But it's all been really within the last 100 years. So we're just beginning, and there is so much misunderstanding caused by prejudice and bias. So the next thing I would like to say is that we need to be aware of our own prejudices and biases so that we do not push our own values onto our clients. The clients are most likely already uncomfortable discussing this subject, so we need to be accepting and non-judgmental when we are discussing this in therapy. That leads me to a point that I think is very important, and that is it's important for you as a therapist to be comfortable discussing human sexuality with a client who is a stranger. So ask yourself, what will help you to become comfortable discussing human sexuality in depth with a client? I think one of the things that helps people to become more comfortable is a thorough knowledge of the topic from the DSM, and there are many other professional books about how to treat this. You cannot become a there's lots of names for it, but a counselor who specializes in human sexuality. People call it a sex therapist. That has a number of different connotations. There are all different levels of that. But I'm just talking therapeutic talking, okay? At a professional level, following all of the ACA guidelines. So no physical interaction with clients, just discussion. But you need special training to do that. I've had many students who want to do this. Some students who have gone ahead and tried to do this, but they were not qualified. You need a lot of experience and training to talk about this with clients. Now, you can talk about it at a general level, but if there are some more serious problems, you need to be able to handle this at a professional level with a certain degree of knowledge. I've had a lot of experience in different areas, and I've worked with a broad spectrum of clients. I started teaching this course as a doctoral student with Dr. David Delmonico at Duquesne, who's done a lot of research on sexual addiction and the internet, and he's pretty cutting edge. And so I co-taught a class with him while I was a doctoral student. And then I've had very many different kinds of clients, and with every client, I received supervision and did further research. And I would say that clients ran the entire spectrum from your average couple not being satisfied in this aspect of their relationship, all the way to working with people who wanted sex changes. The next thing I'd like to say is in my experience, one of the most common issues is people coming into counseling as couples, or sometimes they'd come in by themselves, and but it was a couple, it was a relationship problem. And one of two people or both people were not satisfied in their relationship in the area of human sexuality. They always found it, they always questioned that I didn't, I did do a basic assessment to make sure there were no physical problems. But after that, I didn't just talk about their sex lives. I really talked about their relationship with them. I found that because there is so much focus on sexuality in an unhealthy way on the internet or in books or in the media, people think that they should be doing certain things, or or perhaps they are exposed too much to pornography on the internet. It's become a major problem. And the expectations are off, or what I've really found to be a problem is that people are no longer present for one another. An example of that with sexuality would be fantasizing. Individuals begin to fantasize about things they've read or seen on television, or most likely what they've seen on the internet. And when people are fantasizing about strangers or unhealthy things that they have seen, they're no longer present emotionally for the person they love. And that creates a separation and an objectification of the individual. There needs to be emotional intimacy in a relationship, more than just physical intimacy. And that is more likely than not one of the largest problems that I've encountered with people. So we work on creating emotional intimacy, which means really getting to know one another, being present for one another, not thinking about things that create anxiety, not fantasizing about other people, but thinking about the other person in the relationship outside of sexuality on a day-to-day basis, like having dinner or sitting together in the evening, not looking at your phones. Sorry about that. My alarm. So not looking at your phone so much, or cutting out all of the unhealthy things that distract us from a healthy emotional relationship. So being present and mindful of the other person in a relationship. And I would say one of the other things would be to cut out all of the sexualized material that is taking us away from our real relationships. That would include pornography or other things. So the first thing I usually talk about is basically intimacy, but emotional intimacy. Later, we can talk more about physical intimacy. The next thing I want to talk about is LGBT issues. A while ago, not in the last edition or this edition, but a few editions ago, LGBT issues were seen as disorders in the DSM. We've come a long way since then, but we still have a long way to go. It's still an issue of contention and bias in our society. And it really doesn't have to be. There's a broad spectrum of sexuality. I don't have to get into this really in depth, but you'll notice that, of course, we have LGBT, but we're adding on more letters, Q, questioning, I, all kinds. There are all different terms for different gender identities. I would say, personally, it's my personal opinion, that it's not as cut and dry as people think. So you're not just heterosexual or homosexual or gay or lesbian or transgender. There's more gradual differences between every human being along that spectrum. So even though I am personally a heterosexual, I am very different than another heterosexual male. Everyone is different. So just because you identify with a certain category, heterosexual male, whatever it might be, every heterosexual male is different. Every lesbian is different. Every homosexual is different. Every bisexual is different. Every transsexual is different. So, it's not just, oh, I am this. Every person is different sexually and in every other way. And that is what we have to begin to accept. We can't say, oh, you are a, fill in the blank. We have to look at every person as a unique individual. So I could not post it because of copyright issues. However, if you've ever listened on the radio or to their podcast, This American Life, they have a website for their podcast, and they interviewed a past president of the American Psychological Association, might be the American Psychiatric Association, but he tells the story of how they were able to remove homosexuality from the DSM as a disorder, and it is no longer a disorder. Of course, now we've come a long way with marriage and other things, but we have a long way to go as well. But if you're interested in the history of how they removed homosexuality from the DSM, just look up This American Life and then do a search on their site for DSM, and it should pop up. It is an excellent interview. And okay, so I would like to begin with a story of my most successful counseling. And the point of this story is, do not make assumptions. Okay? So I was referred from a medical doctor, a married couple who were young, in their early 20s. They wanted children, but they both had mild cognitive disorders. They made it through school with a lot of special programming. They took marriage and parenting classes. They did genetic testing. Their child would not have any cognitive disorders as far as genetics. They had a wonderful support network to help them raise a child. They both had jobs, so they were able to support themselves and a child. And everything seemed great. And yet they could not have a child. So then they went to all of this testing. Nothing was wrong with them. And this was causing some emotional issues. And so they were referred to me. And, I went through a basic assessment, and they were both very happy with their sexuality. They were both satisfied and no problems. So we talked about all of their emotions that were tied to not having a child. After about 3 sessions, I decided that I needed for them to walk me through exactly what happens sexually. And they both told me exactly what happened. And what I found out through this assessment with more depth and specifics was that, yes, they were both satisfied. Yes, they were both satisfied sexually. However, they never actually had intercourse. So they were doing everything but having intercourse. And I said to them, I think I have figured out your problem. And, so I gave them a book that talked about all different aspects of sexuality, and they were to read it, and we were going to discuss it, and when they felt ready and comfortable, they could try having intercourse. And the very next week, they came in to counseling, and I've never seen two people so happy in counseling in my life. It was a very successful counseling session. But the whole point of this is, don't make assumptions. You have to ask in order for people to tell you enough depth. The next thing I would like to talk about would be, I'm not going to get into a lot of LGBT things, but just what I feel is very important. Most people who identify as LGBTQ or anything along this life spectrum, or if they're questioning their sexual identity, without exception, they are experiencing other emotions. They have felt judged, misunderstood, questioned. They have experienced some form of prejudice. So counseling has to deal with multiple issues, not just facilitating awareness of their personal sexual identity and what they are comfortable with, but there is building trust, there is non-judgment, there is a comfort level that has to be achieved in discussing these things. And then we have to address the emotional harm that they have experienced because of society's bias, or maybe their own family's judgment and non-acceptance. All of this can play into acceptance of self or self-questioning. Am I okay? Well, I think every human being asks that, especially sexually. Am I, quote, normal? Whatever that is. There is no normal, or everything may be normal, as long as it doesn't hurt anybody. So that is definitely a part of the process. Acceptance, self-acceptance, and then also facilitation of awareness, walking through this process with them in therapy. Maybe two people are in a relationship and both of them are at different places, or, another thing that I would like to say is that a lot of times couples will come to me and, they might be an LGBT couple. Well, in any of those scenarios, one of the things that counselors look at first is their sexual identity. I look at that relationship just like I would at any relationship, and I would begin to discuss emotional intimacy. And I think that is part of accepting them as human beings. A person is not just their sexual identity. A person is a human being with everything that includes. So we talk about intimacy, emotional intimacy, and we get to sexual intimacy, physical intimacy, but I handle every couple pretty much the same. And then, of course, every couple is also different. Okay, the next thing I would like to discuss is individuals who have a physical problem, and then we also have to deal with the emotional side to that. If anybody is telling you that they are experiencing pain or discomfort, then it's important to work with a physician and to refer them. I would like to touch upon sexual addiction. When people deal with their own sexuality, and doesn't matter who you are, part of that sexual process is the goal of having an orgasm or finding sexual pleasure. And that is not just a physical occurrence. It releases a lot of chemicals in the brain that are pleasure chemicals. They, are endorphins and oxytocin and things that are similar to drugs that you could take. And it's different for every human being. But nature has combined pleasure with sexuality so that animals, humans, have an incentive to procreate, to have offspring. And we can get into, all of the different issues with that. But that's what most scientists believe that is combined for. And I'm not saying that is the only reason to have a loving relationship. Of course, it is not. Love moves beyond procreation. There's adoption, there's not wanting to have children. All of that is acceptable. So you see how complicated this gets. I have to, I say something and then I have to clarify because there's just so much included in every statement. So what happens with sexual addiction is, rather than becoming addicted to a drug that you take, people become addicted to the chemicals that our brains create through sexuality. It may help to relieve anxiety or depression or some other comorbid diagnosis or symptomology. It may help people to feel as though they are not alone. People can feel alone even if they're in a relationship. Another misunderstood thing is that people think sexual addiction always has to include another person, but it does not. It can simply include masturbation, or it could be an addiction to pornography, but it could include other people. I think there's a lot of misunderstanding about sexual addiction because of what we see in the media. I think a lot of famous people get a diagnosis of sexual addiction when in reality it's an excuse for being unfaithful in a relationship. Having an extramarital affair or an affair outside of a relationship does not mean you have a sexual addiction. It simply means you are being unfaithful to a relationship and looking outside of that relationship. Sexual addiction is having to achieve a certain level of pleasure to produce those brain chemicals many times every day. So, it wouldn't just be having sex once a day. It would be finding that sexual pleasure one way or another multiple times a day, just like any drug addiction. And it would progressively increase and get worse. It would begin to interfere with our normal life functioning. Sexuality in older age. Oftentimes, I have talked with people at elderly care facilities or independent living facilities, and they want to have relationships. And there may be some physical differences, but there is no difference emotionally. No matter what age we are, people want contact and intimacy, and they want to express that physically. People can love and have relationships no matter what age they are. So, with the invention of Viagra and other medications, this is very possible at any age. The problem arises with prejudices in facilities. They might not be allowed going to another person's room at night, something like that. They might be discouraged from having sexual contact for whatever reason. That is unethical unless there is a physical reason they should not. They are human beings and should experience the full spectrum of human intimacy as they see fit, as long as everybody agrees to it. So I would say be careful of bias related to age. I would also say every culture has differing ideas, biases related to human sexuality. So that's my overview. I have a list of basic sexual dysfunctions. A lot of them are a combination of physical or emotional. Differential diagnosis is very important, and it is more difficult in this category. So, for instance, vaginismus, involuntary contractions of the muscles around the outer wall of the vagina prevent entry of the penis. This can be primarily a psychological fear of intercourse that creates anxiety, muscles tense, and it prevents sexual intercourse. But individuals often complain of pain, and that could be associated with it. This is often misdiagnosed as a physical problem. However, there are very specific treatments, both emotional and physical treatments, that you can use to overcome an issue like this. One of the most misunderstood categories is paraphilias. Philia means love. It can involve non-human objects. It can involve children, non-consenting adults, or suffering or humiliation. Many can only become aroused when stimulus is present or fantasized about. It's believed that a large part of the population may have this disorder, but they hide it based on the sales of specific genres of pornography. There are many specializations. However, very few are ever actually diagnosed. The main thing I can say about this is if it harms another person in any other way, or if there is a factor that is non-consenting, it is unethical and it needs to be reported if it has occurred, or if they plan to do something that could harm another person. Unfortunately, less than 20% of clients suffering from a paraphilia are, I don't even like using the word cured, but are able to be helped, are able to change. That is because at some point in their at a very young age, when their brains were creating a cognitive map linking dendrites and neurons regarding their sexuality, something happened. It could be anything. It doesn't have to be abuse, but it could be abuse. And they created a cognitive map that linked pleasure to something very specific. And a cognitive map, because it's made up of dendrites and neurons, is very difficult to reprogram or change. I would say that they have done many studies. LGBT is not just a cognitive map, it is genetic. All right, fetishism is a little different. The key features are recurrent, intense sexual urges, sexually arousing fantasies or behaviors that involve the use of non-living objects, often the exclusion of all other living stimuli. Almost anything can become a fetish. There are fetishes in a movie called Crumb. I don't condone the actions in this movie, but it is an interesting psychological piece. This also includes transvestic fetishism. It could be something as simple as shoes. I talked about some different things in the notes: exhibitionism, voyeurism, all kinds of different things. I think one of the biggest books, it was not written very well, but I had to read it because all of my clients were talking about it. Of course, 50 Shades of Grey, with sadism or masochism, all having to do with the inability to let go of control. I could have an entire lecture just on this, but it's an example of a normalizing of something that was seen as taboo in our culture. The most important thing in any relationship needs to be consent. Both individuals need to agree about what is happening, and that needs to be talked about. People don't want to talk with their partners about sexuality, and that's something that we practice in therapy. We practice, let's talk to each other, and I will help you facilitate that conversation. I know I didn't get into extreme detail in any one of these things, but like I said, this is an entire course, and I hope what I did share with you was helpful. I hope I didn't offend anybody in any way. If I did, I apologize, and email me with questions. Thank you.